So what are the treatment modalities out there? So as I mentioned, the types of treatments that we employ depends on the types of scars that we're dealing with. Let's talk about atrophic scars or indented scars. Most of the time, the underlying principle when we deal with atrophic scars is controlled injury to the skin to allow remodeling and rehealing of the skin. Atrophic scars happen as a result of inadequate collagen production during the injury process of acne. And in order to treat atrophic scars, what we are trying to do is to deliver controlled injury to the skin, either by physical injury to the skin or energy-based devices, for example, to try to stimulate that collagen production and level out the atrophic scars. Examples of these modalities would include things like lasers, for example, the commonest treatment for the last few decades. Recently, we've moved on to other energy-based devices such as radiofrequency microneedling or ablative radiofrequency devices. Older methods that still are sometimes relevant in this day and age would include modalities such as chemical peels, whether we use them as a general peel for the whole face or we use them topically on spots such as the TCA cross method. These are methods that we still employ these days. Some patients with the indented scars will benefit from treatments such as fillers to help to raise the base of the indented scars to try to improve the appearance, and often fillers employed together with other physical methods such as subcision, in which we use a needle to try to cut and release the underlying scar tissue from underneath the skin. So these are various methods that we use as controlled injury to help to raise atrophic scars. When it comes to hypertrophic scars, such as keloids and raised scars, basically the treatment involves trying to soften up the excessive collagen production that has occurred as a result of the injury. Hypertrophic scars often occur in patients who have a genetic predisposition or in areas where there's high tension onto the skin, and it's important that we try to treat hypertrophic scars quite carefully so that we avoid excessive inflammation that causes the scar to raise even more. So some of the modalities that we can use are lasers, vascular lasers such as a pulse dye laser or a yellow laser to try to reduce inflammation and redness of the scar. We also use modalities such as injections, intralesional steroid injections. These help to remodel the collagen production in that particular area and soften up the scar. The most severe cases, sometimes patients require what we call a scar revision surgery, make an incision and cut out the scar and hopefully get the skin to heal again in a more controlled manner.